Hi, I'm Dr. Valerie Sutherland. I'm here with your daily dose of information on the disease of obesity. Today I'm going to talk about the concept of a weight set point. Studies show that there's something called a weight set point, and this is a weight that your body generally goes to for the genetics, the environment, and the age that you are at currently. Many people have sort of figured this out over time. They'll come in and say, it just seems like my body naturally goes to whatever weight. Say, for example, 240 pounds. And they'll go on a focused plan, do something, maybe a 90-day challenge, and their weight will go down, but at a certain point they'll hit a reliable plateau. And then when they hit the plateau, motivation can end because they're not losing weight anymore. And then slowly over time, their weight tends to go back to that same weight. And studies show that this is physiologically determined, and there are things that can be done about it. So it's not to mean that this is discouraging, that you don't have any control or way to affect your weight. But I do find that it tends to be helpful to kind of have that weight set point in perspective, because it's helpful to think of a weight change in percentages from that weight set point. And then that can make any plateaus or slowing of weight loss or somewhat unexplained weight regain make more sense. Whereas before you may have felt like, hey, I'm doing the same things, but my weight isn't coming off anymore. Or, I don't seem to be doing that badly, but I'm gaining weight. Well, if you keep your weight set point in mind, it can kind of make things make more sense. So a way that you can do this to determine what your weight set point is to do a little bit of a weight history. And if you kind of draw your weight over time, you might find that there's a high weight that your body has been, and then there's a low weight that your body has been, and it tends to cycle maybe in between. And it may go up with things that make sense, pregnancies, or just every decade you get older, especially if you're a female and you get to 40s. But you can kind of get a little bit more perspective. And then you look at percentages. So if you, for example, have a weight set point, somebody of 240 pounds, losing 10% of one's body weight, which would be about 25 pounds, really just starts to kick in that metabolic adaptation where the body's kind of fighting further weight loss. So say you work past that, you lose 20% of your body weight. So if you start at 240, you've lost about 50 pounds, you've hit 190, and you're feeling great. Well, you need to keep in perspective, you're 20% below your weight set point. So at this point, your metabolic rate goes down, hunger and cravings can go up, and it's really helpful to know that, hey, this is chemistry, this is physiology, this isn't something that I'm just losing willpower, losing focus, it's not my imagination. Okay, now I know what it is, I understand, I can deal with it. So think about your weight in context of your weight set point and in percentage change from that weight set point. So don't just look for linear weight loss measured in pounds, because that's going to give you the wrong idea. And if you get the wrong idea, then that can lead to frustration. So if you want to learn more about weight set points or percentage changes to help you guide with your weight loss, then stay tuned. Thank you.